Well, COVID-19 is disproportionately infecting minority populations, with African Americans having the highest hospitalization and death rates. The Indiana Primary Health Care Association says that's just one reason why community health centers are playing a critical role during this crisis. Business of Health reporter Kylie Veleta has more. Kylie.
Thank you, Gary. The Indiana Primary Health Care Association, or IPHCA, oversees community-oriented primary care initiatives, including community health centers, which focus on underserved populations. One of IPHCA's biggest victories during the pandemic has been spearheading a huge increase in telemedicine. Here to tell us about that and other ways community health centers have been on the front lines of battling COVID-19 is Ben Harvey. He's Chief Executive Officer of IPHCA. Ben, thanks for being on the show today.
Oh, thanks for having me. I appreciate the opportunity.
So before we talk about how COVID-19 has impacted your work, let's talk just a little bit about community health centers in general. There's 35 of them in Indiana. Explain the mission of these centers.
Yeah, so community health centers are community-driven primary care healthcare providers that really come in terms of Indiana, they're from the lake to the river. And so they're federally designated clinics that, again, provide primary care services, outpatient services. So they provide medical, dental, and behavioral health services. They provide them in underserved areas of the state. They are community-driven, so their boards are composed of at least 50% of patients. They serve all patients regardless of their ability to pay, so patients that have Medicare, patients that are uninsured, underinsured. They're designed to be open points of access, particularly for communities that are underserved, like what was mentioned in the top, where the minority populations particularly are frequent utilizers of community health centers. So community health centers really are driven to be those community-based outpatient primary care health homes for underserved Hoosiers.
Okay, so then COVID-19, of course, changes everything. So explain how community health centers have really been on the front lines of this crisis here in Indiana.
Yeah, so there are 35 health centers in the state of Indiana. Again, they have about 250 clinical sites. They serve right around 600,000 Hoosiers every year. And because of the way the COVID-19 has impacted communities of color, particularly in the state of Indiana, health centers have been on the front line in testing, treatment, that connection as a primary care provider. And one of the biggest things that they've done is in terms of reaching patients. You know, there's a big push right now to reach patients where they are, to reach into a patient's home, because you have to either be quarantined or with the governor's stay-at-home order. How can you continue to provide primary care services? So FQHCs, community health centers in the state of Indiana, all 35 now provide telemedicine services and fairly robust telemedicine services. So again, it's kind of a paradigm shift of the provider coming to find the patient in the patient's home. And that's a big transformative event, kind of a return to form for medicine to some degree, but a big transformative event. So you can pretty easily connect with your provider. Also, a piece of that in terms of telemedicine that the health centers have been focusing on in a partnership with the state is a program called Virtual Care at Home. So if someone's COVID suspected or COVID positive, and they are concerned about either going into the emergency room or having to travel to a hospital, they can be connected with the health center, and the health center can monitor and evaluate that patient in their home and stay connected with them through the length of either their infection or their bad feelings. And so we've piloted that with a number of health centers in the state and had some pretty good success with it so far. And again, really appreciative of the partnership that the state's entered into with us, and also our hospital partners and other primary care providers and other healthcare providers in the state. It's truly been an amazing effort, and we're happy to be able to serve the role that we have.
And it really has been huge strides made in that area. You've more than doubled the number of community health centers that now have telemedicine. And this is especially important for your population in particular. You mentioned, there's transportation issues. Can you talk a little about that?
Oh, yeah, tremendously. Yeah, there's tremendous transportation issues, be you in a rural area or be you in an urban area. Having to drive 50 miles in a rural area to access primary care, to access services, having to make 2 or 3 different bus connections in urban areas of the state, being able to, and also if you have a kid, we have 3 kids at home. If you have to take a child in with you, if you're taking the child into the primary care provider, that's a significant piece of time, and it's not always easy to get in to see your primary care physician. So telemedicine really starts to bridge that gap. It really reduces the time. It's beneficial for the patient. It helps the patient connect to providers in a way they couldn't otherwise do. And it also, too, again, I want to focus on this. This is a big piece, is that idea of a provider coming to see you at your home, that connection, even though it's virtual, that connection and that opportunity to talk to a provider in your own home, that's a big deal. That really is. And so I've seen some national numbers. We've seen probably about 25% of all Americans now have visited a primary care physician or a physician via telemedicine, which is a huge increase in terms of access to care for everybody, particularly the underserved when there's transportation barriers or other barriers to care.
Okay, and just a few seconds left, but we hear some medical centers are struggling financially. How are community health centers weathering that storm?
Yeah, it's same for community health centers. You've seen a big drop off in patients going in to see the physician. We've seen a big drop in patient volume. So we've taken a financial hit a number of health centers have. Health centers are pretty robust. They're community-driven, they're mission-driven organizations, so they're always going to be there to provide services. There's been some relief from the federal side. We've been working with the state, trying to figure out if there's an avenue there for the state to support health centers. But I would encourage people, if you need to see a primary care physician, health centers are a good place to go, particularly with the ability to see a physician via telemedicine.
Okay, Ben, thanks so much for being on the show today. Appreciate it.
Thanks for having me. I appreciate it very much.
All right, Gary, back to you.
All right, Kylie, thank you.